Yeah. So you have seen what are the important words I have told you: allergy, falling, and breathless. These are the problems. Warning. Anybody will warn about the problems. This is the secret. This is the secret. So enable annotation for others. Okay. So here it is. I have a mark. Blue. One-sided. Okay. Briefing means warning. Warning is allergy. Warning because allergy. Warning about allergy. Warning about falling. Warning about breathlessness. Okay. So try to understand this one. Allergy to antibiotics, prevent from falling, oxygen if breathless. So these are the things. But the main important, see, arrows are going where that is important here. Allergy, falling, and breathless. Allergy, falling, and breathless. These are the three words. Warning about allergy, warning about falling, warning about breathless. This is how you have to focus. Okay, that is number one. Okay. Next, coming to the point. So this is called reading between the lines. Briefing means warning. Briefing about, red mark. Warning about what? What means something. What means something? Something is allergic, allergy, or falling, or breathlessness. So that's it. So he may be talking about antibiotics, or falling, or breathlessness. These are the three important points. Again, forcing there. So print the screen. So focus on these three words only, nothing else. Right. Okay. Clear all drawings. Okay. Now, next, level 2. Yes. Was admitted means starting with past tense. And last night means the okay, last night means before, ago, previous. Okay, yesterday night. Okay, for pneumonia, she came, past tense. In yesterday, last night means yesterday night. You can see yesterday. These are all related to past tense. Was means past tense, last night means past tense. Came means past tense, yesterday means past tense. So you are using came. So because why are you using came? Because it is yesterday. Tomorrow, she will come tomorrow. Today, she is coming today. Okay, she was admitted last night. She is going to be admitted tonight, and she will be admitted tomorrow night. So tense differs based on the time frame. Last, yesterday, last, that means past tense. Now next one, she is means present tense. Change to present tense now. From now onwards, there will be a present tense. She is, present tense. She is, present tense. Okay. At high risk for falls due to her dizziness. We changed, again going to past tense. Okay. We changed, past tense. Which she is means present tense. Her assessment is present tense. Okay. Her vital signs are present tense. She is, present tense. So focus on these areas. I gave, past tense. She has, present tense. She's got, present tense. Now try to understand here. Miss Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness, and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she is tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable. Oxygen saturation is 98% on 1 liter, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 miles per hour. What is this, mils? Okay. Normal saline at 15 miles per hour. Okay. Or what exactly it is? Okay, fine. Okay. So let us not go in deep into that one because it's a little confusing. Okay, we don't bother about that one first place because the answer is not there. Okay, so past, present, and future. Yesterday she was admitted. And yesterday night she was admitted, that is past tense. Today, during daytime, I am the care nurse. And then now I am transferring the job to you. So she is briefing everything to her. So that's it. So be careful. Warning. For what? First one is, so there are 3 words. There are 3 words. Okay. Right. Okay. Allergies. This is one. Allergies. Number one is allergies. Number 1, falls. Number 2, falls. Number 2, falls. Number 3, breath, shortness of breath. Number 3. So these are the 3 points. Now 3 points come in a sequence. Let us see those 3 points very carefully. Allergy, so I can thin it out. Allergy. Okay. The next one, falling, falls, breathless, breathless, breathless. See here, the words are like this, confusing, but they're so simple. Breath, breath. Less means shortness. See, the one word is equal to 2 words. How they are twisted and reported. Breathless means breathless means shortness of breath. That's it. She is short of breath or shortness of breath. That's it. So oxygen may be needed. Oxygen saturation is 98%. So why needed? Okay. Saturation is 98% on 1 liter. On 1 liter. And she's been comfortable. Everything is fine regarding. Fine. Now, no allergies. So the rule, the twist is here. No allergies. No allergies. She has no allergies. The patient is allergic to some type of antibiotics. No allergies. No allergies. Here he is telling no allergies and he is telling some types of allergies. Allergic to some types of antibiotics. Some antibiotics, allergies. So this is ruled out. This is ruled out. This is ruled out. because he's telling no allergies, and here he's telling allergic to some types of. So this is positive, that is negative. No allergies. Sentence is negative, but the statement is positive. She has no allergies. That means good. Sentence is negative, no allergies. Sentence is negative. Try to understand this, because no, the word no is there, negative sentence, but the result is positive. No allergies is good. Yes, allergies is bad, but no allergies is good. See, statement is positive, but the sentence is negative. But here the statement, the patient is allergic to some types of, the sentence is positive, but it is negative. Try to understand that. It is totally contrasting. So they are not matching. So the answer is ruled out. Then next. So oxygen may be needed. Mild shortness of breath. Mild, very low. Mild means very low. Except some mild shortness of breath. Her assessment is within normal limits, except for some mild shortness of breath. Not major, mild. Now you have to know what is that mild. So if you know mild, the meaning of the word mild, so mild is very important. Okay. So I have closed them. No? Okay. Mild. Mild means what? Not violent. Okay, not severe, not extreme. Not violent, not severe, not extreme, means very light. Okay. Very light, not violent, not severe, not extreme, means non-violent, less severe, okay, less extreme, means lightly. So that is the meaning, lightly. Okay. Mild weather is not very cold, means less cold, less cold. So mild means very less. Okay. So fine. So mild means very less. So here, mild shortness of breath, very minute, very less, very minimum, minor, small quantities, that is called mild. And wheezing. Her vital signs are stable. Oxygen saturation is 98% on 1 liter. So that's it. The patient chances of becoming less, breathless, is very less because it's mild. She's been comfortable. So there is no chance. Okay. She's been comfortable during my shift. That's it. So that's the point. So answer will almost always be in the middle of the sentence, the essay. Answer will almost always be in the middle. Now see here. Care must be taken. Okay, she is at high risk. Risk, that is the warning. So I'm taking a thicker line now. So warning. So she is warning about the risk because it is very high. And this risk is very high for falls. And this falls is due to dizziness. And because of that, she is warning. That is, she is warning about. Okay. Right. So dizziness. If you have dizziness, you will fall. Okay, falling is here. So prevent from falling. Prevent from falling. There is the matter. That is the subject. Focus on that area. So once again, I'm showing the connectors. I'm showing the linkers. How you are to mark there. Now let us see. Now, briefing means warning. warning about what? About something, and that something is the high risk. That high risk is because of dizziness, and because of this dizziness she is fall. Okay, falls due to dizziness. Due to this dizziness she will fall, and that is called falling, and you have to prevent that one. That is, okay, the suggestion. That is the suggestion given. So she is giving the suggestion because of this. Prevent falls. Prevent falls. Okay. So this is how it's very clear now. Okay. So C is ruled out. So first one is past, present, and future. Always think whether the time. Time will help you a lot. Time will help you a lot. Next one is positive and negative. Positive and negative. Okay. Positive and negative. She did not tell care must be taken, but risk of fall is there. So care must be taken. It is reading between the lines. Reading between the lines. She is at high risk for falls due to her dizziness. So that's why care should be taken. So it's warning indirectly. You should understand. You read between the lines because she has a high risk of falls. You have to take care. That is the meaning. Okay. So this is the way how you have to analyze. No need to read everything. No need to read everything. Okay. If you read everything, you'll be confused. Just see what it is, the words. Okay. Allergy, allergics. Okay. Then falls, falling. Breathless, shortness of breath. Allergic, allergies. Falling, fall. Breathless, shortness of breath. No two words will be same. They will be modified. Falling became false. Okay. Allergic became allergies. Breathless became shortness of breath. So don't think that the same words will be there. Okay. Yeah. Now, clear all drawings. So, how would you grade the question's explanation? Okay, how well you have understood the question, the strategies, the topics. You can score for yourself, not for me. 0 to 10 grade. You give your knowledge regarding the session now. How well you understood. So 0 to 10 you can give so that I can understand whether it is necessary or not. So hit the button, 10 seconds time. You can put 0 also. 0 for the least and 10 for the best and 5 for the moderate. So if you are not able to understand, I have to change my style because your understanding is more important for me. Right. So now I'll ask 2 candidates. Okay. 2 candidates. One is, Leung from the United Kingdom. Yes, Leung. I don't know what is Leung. Okay. Yes, can you share what did you learn today now in this question?
Can you hear?
Yes, of course.
The definite answer must the risk is the negative point, not the mild or the positive point.
Right. Okay. Next, Harpreet. Harpreet, what new thing did you learn today? Yes, please. Fast, fast. Sibia. Sibia.
Hello.
Yes, Sibia. What new thing did
Yes.
you learn today?
Yes, sir. I am able to. I learned from this in order to eliminate the odd ones through the negative meaning which has given in the option, which was positive in the paragraphs.
Good. So this is called inductive and deductive method, or eliminating the odd man out theory. Okay, fine. So now we are moving to the second question. Okay, second question. Okay. Now the second question. See, in the case, care must to be taken, it seems. Care must be taken. How come? This is in the official paper. Care must be taken.
Yes, sir.
Yes, Harpreet, you wanted to speak something? Yeah. I think your mic released now. Okay, speak something. What did you learn today?
Sir, I would like to ask you if you could take like these classes every day. Mean take one listening or reading. Tell everyone do this. Mean like this. No, everybody one is and is responding, so the class become more interesting.
You want me to
Yes.
take everyday listening only? No need reading?
No, listening and reading both.
Okay,
Like
one day listening, one day reading, because otherwise my head will blast off, no?
Yes, sir. But even now, like for example, don't like if you want, I can understand you what you mean. But I was just telling, like, no, for the time
Hmm.
management and to understand where we are lacking, for especially reading.
Okay,
Yes, like for
okay,
example, I
fine.
like very much when you give us like you have five, you have write your answer in 7 seconds. So just
Hmm.
starting counting, seven. That is very interesting because that will help us to prepare like how the real exam it will be. It will be like that.
Hmm.
We have very few time to do everything.
Okay, fine, fine. I'll follow that one. I'll follow that. What do you think about the session? What did you learn? That is what I'm asking.
Yes, sir. Time management first of all, and another thing to focus in detail, especially plural and singular are very important.
Hmm.
That is what I learned. From this
Okay.
session, they are of the B that like for example, this is a classical question that I always put the wrong answer. So today I learned how to give a correct answer, the relation between present, past, and future, especially.
Okay. Okay. Fine.
What I
Fine.
learned, you can because it's not. I always put a wrong answer in this type of questions
No worry. We'll learn
because
slowly.
yes.
Okay. Now we are moving to the next question. Okay. Right. Same style you can apply here also. This is question number 26. This is question number 26. Okay, now let us see here. You hear the manager. So the manager is talking. manager of a care home for the elderly, aged care, talking to the nursing staff, all the staff. He's talking to them. He says that errors. So he's talking about mistakes, errors, faults, defects. So this is the main problem. In dispensing medication, errors happen mainly because. So errors in dispensing medication to patients usually result from. This is cause and effect. Result from means cause. Result from, cause. What is the cause? That is the danger zone. Result from means what is the cause? Resulting from a cause. Cause and effect theory, write down. Cause and effect theory. Behind every result, there is a reason. Behind every effect, there is a cause. So what are the causes? So, is it talking about dosages? Is he talking about dosages? Or is he talking about allergies? Or is he talking about late? Late. Okay. Not late, drugs. Is it talking about dosages? Or is it talking about allergies? Or is it talking about drugs? Allergies, internal, dosages you are giving, drugs prescribed by the doctor. Drugs prescribed by the doctor, dosage means amount of drug, allergy. So if you are having allergy, you will get a drug and based on the dosage. So how much of the medication for the problem? First one is how much, means quantity. Second one is drug, means medication. Third one is allergy, problem. Allergy is a problem. Drug is the remedy. Dosage is the quantity. Is he talking about quantity? Or is he talking about the problem? Or is he talking about the solutions? Number one, interruptions means disturbances. When you are calculating, somebody is coming and interrupting, that is a problem. Calculating dosages is not a problem, but interruptions while calculating dosages. When somebody is measuring dosage and somebody comes and talks in between, or some phone comes and they're distracted, their dosage will go wrong. Okay. The dosage will go wrong. So overdose or underdose. So the interruptions is a problem. Then failure to check means not checking. Not checking. So failure to check means not checking. So not checking. Next one, late administration. So late, being late in the day. So that is another problem. Late, not in time, late in the day. Okay. So interruptions while calculating dosages, failure to check for patient's allergies, administering drugs late in the day. So these are the three problems. So because of these problems, errors, always be careful. Always be careful. Problem, question means problem. Question means problem. Definitely question means a problem. Okay. Now see, he is talking about errors. Errors are because of interruptions. Errors are because of failure. Errors are because of late administration. Administering drugs in the day is no problem. Late in the day is problem. Okay. So these are the problems. Interruption regarding dosages, failure or not checking allergies, or late drug administration. So try to understand Okay, try to understand. First one is during. First one is during. Try to understand that. During calculation. While means during. During means while. Then second one is before, means in advance. Check in advance means before. First one is during, means at the time. Second one is before. And third one is after. Late. Late means after. So during, before, or after. See the relationship there. See the relationship. That is what is called read between the lines. Okay. So exactly when something is going on and somebody disturbs, everything goes wrong. Because we cannot focus on two things. And failure to check for patients' allergies. Okay. So because of that, errors happen. Administering drugs late in the day. Okay, that is it. So now try to understand. Is it talking about, okay, dispensing medication? Is it regarding dosages or allergies? Okay. Medication is related to dosages or allergies or drugs. Change the color. So it is very clear now. Clear, sorry. Okay. I should have taken the big screen and then did this one. Okay. Close. Yeah, here it is. Now I should do. Okay. So right. Errors because of interruptions, errors because of failure to check, errors because of late administration. Dispensing medication. Okay. Dosages. Medication means dosages. Medications is for allergies. Medication is for allergies. Medication is for drugs. Dispensing means calculating. Dispensing means checking. Dispensing means administering. So these are the relation, words in relation. Okay. First one is during, means while. Failure to check before. Administering drugs late means after. So during, before, and after relationship. During, before, and after relationship. This is also time. During means now. Before means past. Future means late, means future. Okay, after, late. So these are the relationships. Okay. Interruptions means errors. Failure means errors. Late administration is error. So what are the different types of errors which occur? Result of what? So these are the errors which happen. Okay. These are the result from what? So that's it. Now let us play the audio. Hide floating.
You hit 20. Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following
Sorry for the interruption. We have a power shortage here. So just bear with me. I'm changing the connection to my mobile phone. I'm there. Okay. I am there with you. So it's power shortage or outage. So please bear with me. And then, yeah, I have connected to my phone. Okay. Yeah. So hide floating. Now let me switch on to the audio once again. Okay. Yes.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is the common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Yes. Now, that is the question. And now you
Question
can go ahead.
27. Briefing on a hospital ward.
So question number. Question 26. Question number 26. Yes, 7, 6, 5, 4, 3, 1, and submit. Right. Okay. I can't hear the audio. Audio is cutting. Okay, fine. No problem. You can listen, try again. Okay. So, right, this power has been restored. Thank God. Okay. Right. So, let us see here. Yes. The internet, let me check. They are connected. Fine. So now here we are moving to the second part. Okay. Number 1. Number 2. Okay. So number 3. Okay. 1, 2, 3. First of all, I have to see here what is the size. 18 area empty. Okay. 18, 1, 2, 3. Should be 18. So this is 18. This is okay. Okay. $16. Okay. Okay. That's enough, I suppose. Right. Now here is the point. Let us study this nurse. Okay. Right. Now let us see here. Errors. Okay. I have to take this one also. No? 1 second. A. Yes. Manager is talking about this. Manager. So 25. Yes, that is fine. Right. Now a quick word about the administration of medication. Okay. Yes. It's great to see how carefully you are all following the new guidelines. And thanks to these error rates, which were always below average anyhow, here have dropped by 40%. It is decompressed. So that means they are very careful. They are already very careful. Dropped already less. It still dropped to 40%. Now, the surveys we have done also threw up some interesting findings, like mistakes. Mistakes means errors. Remember that. Words, words, and words. Be very careful. Okay. Errors means mistakes. It has given here. Okay. Errors. Right. Usually means common. Usual means common. How many times I have told you? Okay. Errors means mistakes. Okay. In the mornings, more common in the mornings. Remember that. Errors are usually means more common. Okay. Mistakes more common in the morning rather than in the afternoons or evenings. That means less in the afternoons, less in the evenings. But here you say patients. He says that errors in dispensing medication to patients usually result from administering drugs late in the day. Administering drugs late in the day. So it is not late in the day. Late in the day means evening. No, it is ruled out. It is ruled out. Evenings is ruled out. Okay. Okay. Evenings is ruled out. 1 second. Okay. Okay. Administering drugs late in the day. Okay, fine. So this C is ruled out. Late in the day means evening or afternoon. Because mistakes being more common in the morning, not in the evening. Not in the evening and not in the afternoon. So C is ruled out. Next. We are not sure why, but there's a clear pattern. Also, we know that being always, almost always, answer will be in the middle. Answer almost always will be in the middle. Okay. Now let us see. We are not, also we know that being disturbed. Now see here, how many times this word comes? Disturbed. Disturbed means what? Interruption. If you don't know the synonym, whose mistake is it? Learn. Okay. Interruptions means disturbance. For any reason. While means during. Reason means cause. Result. Don't you see that? The reason, for any reason, any cause, while working out and preparing doses, calculating dosages, is a common, means usual, reason which causes result, for mistakes, for errors. The answer is there. So try to understand how I have been pointing out everything there. Common reason for mistakes, usual, result. A reason means cause and effect, means reason and result. While means during. Okay, just to go ahead again. So now let us see once again. I'm showing in a different angle, elimination process. Okay, this is induction method. Earlier I have shown you elimination, how to eliminate. Now I am showing you how to get the correct answer. So, disturbed, being disturbed, being disturbed, being disturbed means interruption. While working out and working out ing and preparing means calculating. Working out and preparing means calculating. Doses, dosages is a common, usual reason which gives the result. Mistakes, errors. Okay, that's so clear there. Okay, so clear there. Distracting, again the answer is given here. Distracting, avoid. Please try to avoid distracting your colleagues when they are doing this. They are doing means when they are calculating. This means dosages. Okay. So 2 places answer is given. Try to understand. Yeah. So usually means common. Errors means mistakes. Okay. Errors means mistakes. Calculating means preparing and working out. While reason, okay, result. Then common, okay, reason here also. Distracting means interruption, disturbance. Okay. Distracting means disturbance. Okay. Right. So, dosages. All the answers are there. Doing this means calculating dosages. This means dosages. Doing this means calculating dosages. They means colleagues. Okay. So, all the words. Answer always almost will be in the middle of the essay. Okay. Right. Next, now this is the induction method. Now deduction method means eliminating the points. Eliminating the points. Now look at eliminating the points. Now, finally, we must be on lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had these too many problems of this nature. So no problems regarding this nature, allergies and other things. So there is no problem, no problem. Fortunately, we haven't had too many problems, means very less problems. So that's not a big issue. That is not a big issue, eliminated. So there is nothing called failure to check patients' allergies because that was not a big problem, he says. And here, mistakes happen more in the mornings rather than evenings. So this is ruled out. Late in the day means afternoon and evening. That is late in the day. Early in the morning problems happen. Early in the day, not late in the day. Mornings, more problems. So C is ruled out, B is ruled out. So easy. So this is 200% correct answer. So elimination and induction and deduction methods. Induction and deduction method. Okay. Right. Print the screen. I don't know whether I have saved this one or not. Okay, question is not posted. So I have to post a double now. Control V. Then again Control V. Then I have to delete. Clear all drawings. Then next one I have to go here. Go back. So I have floating. So this one I have to post a second question. Okay. Print the screen. Replace this. Edit. Change picture. Yes. So question number 1 and question number 2. Okay, that's fine. So, right, those are the questions I have explained. I have explained 2 questions. You can follow them up in the similar fashion. You can go with the remaining questions. You can go with the remaining questions. Knowledge is not easy. We cannot learn everything overnight. People want fast food, but I know only mother's love. I cannot give you fast food and give you stomach pain. Many people, they just throw everything at your face and they say, go do it on your own, check on your own, and don't come to me. Why are you asking me? Why are you disturbing? Nobody can teach reading. Nobody can teach listening. Okay, that is not my style of. I'm there to help you. But because students also trouble them like that. They're not patient. See, I'm explaining, but people don't have time. Okay, in the morning they're working, in the evening they don't have time, they are sleeping. Okay, they have a lot of work. They have a lot of work, so they are helpless. So what you have to do is give me time, I'll teach you. And tomorrow, reading. Reading. Tomorrow is reading session. How many of you are interested? Interested. Okay, if you are interested, say yes. Okay, tomorrow is reading. I have done a lot actually. Yes. So now my dinner time. I actually wanted to eat, but I came and cooked. So now I am going for my dinner. So after that, I have some corrections. Then I'll go to bed early in the morning. We'll get up and 9 o'clock we'll join. And all the students, all the regular students, okay, Lineo, you have completed 6 speaking sessions today. Very good. Right. Harpreet, you have completed 6 speaking sessions today. Very good. Sibia, I don't know whether you have completed or not. I don't remember exactly, but I have the, yeah, so that we'll see later. So all of you finish your speaking sessions as early as possible so that we can start with feedback. But because you are finishing till late, I'm not able to do much. So tomorrow, those who have completed 6 speaking sessions, tomorrow early morning, I'll give feedback. Okay, remind me. Good night. And before leaving, write a word or 2, sentence or 2. So that is your feedback. So that I can post in the Telegram channel so that the other people will know that something is good is happening here. And those who are serious and those who want to attend the regular, so new students, for example, Divya Sham, then Jasin, Jismi. Okay, these are the new students. Okay, if you are interested, you can contact me for attending regular sessions because I'm giving a special package for you all. Okay, so based on your seriousness, what you require, you can talk to me, you can message me, then I'll follow it up. So So write 1 or 2 sentences before leaving. So we are starting a new batch. Okay. So those who are serious, not working, okay, they can attend for full course and 1 month. Okay, and those who are going for the 27th, is it 27th of May? Some students are going 27th or 28th. Just a minute. Okay, I have to check my WhatsApp for that. Okay, 27th or 28th. Okay, let me check Saturday. Saturday is 28th. Okay, so 28th of May. Those who are going for this last and month ending. Okay, so they can contact me. Those who are on the YouTube, those who are watching YouTube during the daytime. Okay, you can just contact me. Those who are serious, they have a crash course for the 28th May. Okay, and 1 month course for those students who are going for repeating exams, and a full course that is 100 days for those who are beginners and need to practice a lot. Okay, so you can contact me personally and you can send a message. And those who want to attend only lectures, okay, you can contact me on my application. Yeah, and if you have any requests, okay, if you have any requests, you can message me here. Okay, so if you have any requests, you can message me. So if you have any personal problems also, you can message me. I'll take that responsibility and try to do whatever the best possible from my side. Simon sir is hungry. What did I have today? Since morning? Nothing. Only just a cup of tea. I'm famished. Good night. If I eat, I get sleep. That's the problem. Very good. Thank you all for your attendance. I appreciate you for making this class a success. Good night.